Hi there, my name is Dr. Ruben Agbo. This is Radiant Health and you are welcome again. Last time I asked you that you should make sure that you check your blood pressure. Were you able to check? What was your figure? Was it healthy? Do you feel healthy today? So today we want to continue with our discussion on how best we can keep our cardiovascular system strong. Now remember that your blood pressure is linked to your blood vessels, and more specifically your arteries. It means that how healthy your arteries is, you will be able to get a healthy blood pressure range. More than 300 years ago, an English physician called Dr. Thomas Sedina said you are as old as your arteries. It means that how your arteries are determines how healthy you are. So let me ask you again, are you healthy? How is your arteries? High blood pressure does not only put your heart at risk, but it can also affect the entire body, resulting in stroke, erectile dysfunction, low libido, low sexual performance. It can even reduce your cognitive function. It can even cause diabetes. It can even cause problems to your heart. It can cause problems to your kidney and many others. So remember that your high blood pressure is actually linked with your arteries. Now let's look at something. Can you see the blood flowing through the artery? Yes, it is flowing through the artery smoothly. But can you see some formation of plaque in the inner walls of the artery? Yes. But with high blood pressure, there's constant sharing of the protective lining of this plaque in there. Constantly, when the pressure is high, now this lining becomes thinner. It becomes thinner and then it will break away. Before you realize, it will precipitate blood formation. Now, when this blood clots is in the artery, it may prevent blood from reaching other parts of the body, especially the heart, and that will result in heart attack. And that is why you need to protect the inner lining of your artery. Now, the inner lining of your artery is what we call the endothelium. Now, it is this inner lining in the endothelium that protects every plaque in there. It means that if you don't want the formation of clots in your artery, you need to strengthen this endothelium. Endothelium is a wonderful sheath in the artery. Now, this endothelium produces a very wonderful molecule in the body system. This molecule is known as nitric oxide. Have you heard of nitric oxide before? Yes, nitric oxide some years ago was hailed as the miracle molecule. Nitric oxide does three things. Number one, it signals the arteries in order for the artery to relax or dilate for blood to be able to flow very well. So you can see what the nitric oxide does. Number two, now it also prevents the formation of unnecessary blood clots in the artery. And then number three, it also prevents the rupture of the plaque formation in the system. So this endothelium producing nitric oxide does these three wonderful things. So nitric oxide is very, very important. When you have more of nitric oxide, you know that you have a healthy heart. But unfortunately, as we grow, we lose the ability to produce nitric oxide. Yes, that is so painful. But in our next video, we are going to look at why do we lose a lot of the ability to produce nitric oxide. And I know you are going to learn more. But today too, I'm asking you, make sure that you check your blood pressure again and make sure that this time you also exercise in order to keep a healthy heart. This video was brought to you by Radiant Health and proudly sponsored by Nitro MX. Nitro MS, good circulation, big performance. I'll see you in the next video.